in my opinion, the most exciting potential treatment, which will read out in the next year, are the oral BTK inhibitors that target B cells and target myeloid cells, monocytes, and macrophages. And all the major trials have CNS penetrating BTK inhibitors. So we have 2 phase 3 trials that are testing 2 distinct oral treatments for primary progressive MS. In one trial, they're being randomized to the BTK inhibitor or ocrelizumab, which is the anti-CD20 humanized monoclonal, the only FDA-approved drug for primary progressive MS. In the other trial, they're being randomized to another BTK inhibitor or a placebo. And this is really a leap of faith. But if either of these studies are positive, you will now have a treatment that was penetrating into the CNS and able to show a benefit in progressive MS. And I think you will see it widely used. The question will come up is how early to use it. So very akin to Alzheimer's and Parkinson's disease, you have loss of critical cells in the silent period, okay, before you see any description of the clinical abnormalities. It's the same thing happening in progressive MS. We think it likely is. So if you had an effective treatment for smoldering inflammation, neurodegeneration, you might want to use it before you were even appreciative of primary progressive MS. Can we do that? Difficult, but it turns out in radiologically isolated syndrome, where somebody is picked up because of an abnormal brain MRI, 12% turn out to have primary progressive MS as they're followed 5 years, 10 years, and they continue to be followed. And there's a lot of literature on prodromal MS, which is up to years before they present with the first neurologic manifestations. And there are hints that there may be a unique prodrome for primary progressive MS versus CIS relapsing MS. Again, this needs further work, but there's so much exciting things going on with regard to MS, and particularly the focus on progressive MS, which is a real lack, a real need. We not only need specific treatments for progressive MS, we need CNS repair strategies to help somebody that has a significant deficit and to make them better. But literally, there's a lot going on for primary progressive MS.